Good evening, guys. I've got a bonus discussion for you tonight. It's discussion E, and we're discussing whether starting dialysis later in adult elderly is beneficial or not. So we shall delve into that tonight for discussion E. So please join me for discussion E tonight. Kidney function and such. So here we go. Here's a concise summary of the main points. Study overview. Stanford medicine researchers examined whether starting dialysis immediately after kidney function falls below a certain threshold benefits older adults with kidney failure. The study focused on patients not eligible for kidney transplant due to other health conditions like heart disease or cancer. Early key findings. Early dialysis offered only about 1 extra week of life. Patients who started dialysis spent 2 additional weeks in hospitals for care. Give me 1 second, guys. Facilities compared to those who delayed or opted out. Implications. Researchers highlight the need for personalized decision making, especially for older adults. Physicians and patients should carefully weigh life expectancy versus quality of life, including time spent at home versus in care. Okay, Maria Montez Ruth, a doctor, Manjulia Tamara emphasizes the importance of understanding the trade-offs in dialysis decisions. It's a powerful reflection on how medical interventions isn't always the best result. Default choice, especially when autonomy and comfort take center stage. Would you like to dig deeper into how these findings might influence frailty-aware care models or ethical decision frameworks? Absolutely. Really imply let's unpack the key findings and whether they really apply, especially given your interest in frailty-aware care and ethical frameworks. Okay. Do that right here. Dig deeper into how these findings might influence frailty-aware care models or ethical decision frameworks. Let's unpack key findings and what they really imply, especially given your interest in frailty-aware care and ethical frameworks. What does early dialysis actually offer? Starting dialysis as soon as kidney function dips below a defined threshold gave patients just one extra week of life on average. While this may sound like a gain, that week often came with increased time in hospitals or care facilities, which means reduced time in familiar home environments. Quality of life versus quantity. Patients who began dialysis sooner spent 2 extra weeks in institutional settings, so the trade-off wasn't simply more life, but more medically intensive life. For older adults, especially those with comorbidities like heart disease or cancer, this raises ethical questions. Is it better to live slightly longer under clinical autonomy? Broader implications. These findings encourage nonsense decision making rather than reflectivity. Starting dialysis when kidney numbers hit a threshold. The study advocates evaluating overall health status and goals, preferences for location of care, impact on mental health and daily functioning, clinicians like Dr. Manjula Tamura suggest a shift from protocol-based to person-centered care, recognizing that one-size-fits-all medicine doesn't work for vulnerable populations. How this relates to frailty. The study dovetails with frailty assessments you've been exploring. Someone who's frail may experience disproportionate burden from dialysis, higher risk of delirium and hospitalization. lower resilience to lower resilience to clinical interventions, more pronounced drops in functional independence. It's a case study in why medical interventions alone doesn't equal improved outcomes, especially in older adults in elder care. Would you like to explore how shared decision-making tools or proactive modeling could factor into these kind of clinical choices, or maybe delve into memory-friendly approaches to discussing such options with patients and their families? Great question. The Stanford study findings showing minimal survival benefits and increased institutional care time from early uh, dialysis align with growing body of literature that challenges the assumption that dialysis always improves outcomes for older adults with comorbidities. Here's how it stacks up. Comparison to existing research. Survival outcomes. Traditional view. Dialysis is associated with longer survival compared to conservative management. Nonsense findings. Systematic reviews show that survival advantages diminish with age and comorbidity. In fact, some patients who undergo dialysis live several years with stable quality of life. Okay, quality of life. Studies comparing dialysis modules, e.g., peritoneal versus hemodialysis, reveal mixed results. Peritoneal dialysis often scores better on autonomy and emotional well-being. In center, hemodialysis may offer more clinical support but less flexibility. However, early dialysis does not necessarily improve quality of life, especially for frail patients who may experience more hospitalizations and functional decline. End of life care. Patients on dialysis often receive high intensity care at the end of life, which may not align with their preferences. These who opt out of dialysis tend to have more hospice enrollment and die at home more often, suggesting better alignment with comfort focused goals. shared decision making. Recent studies emphasizing the importance of shared decision making interventions, which improve treatment, coordinate, and reduce decisional conflict. Frailty and BMI are emerging as better predictors of outcomes than comorbidity alone. A key insight for tailoring care. What this means for practice. The Stanford findings reinforce a broader staff towards goal-directed dialysis and conservative kidney management. They support your interest in frailty-aware care. Models and ethical frameworks that prioritize autonomy, comfort, and individualized decision making. Would you like to explore how predictive algorithms or smart technologies could help clinicians personalize dialysis, living timing and modality based on frailty profiles, or maybe look into how memory friendly communication arteries can support these complex decisions. The practical implications of these findings are profound, especially for providers who care for older adults within complex health profiles. Here's how the insights from the study can influence critical practices. Rethinking critical protocols. Dialysis thresholds shouldn't be autonomic triggers. The study urges a shift from lab value based decision to assessment. Clinicians should incorporate frailty scores, comorbidities, burden, and functional status when evaluating other dialysis aligns with a person's goals. Promoting shared decision making. Providers are encouraged to infiltrate deeper conversation with patients and families about what matters most. Providers, its longevity and independence, comfort, or time at home. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.